Hey there. Welcome back. Another Stories of Gumption podcast episode coming right at you. What are we doing here? We're having conversations with entrepreneurs, creative thinkers, and in my opinion, just really, really impressive people. So welcome back again. We're really excited to have you here listening to another episode of the podcast. A lot of great guests so far on the podcast. I have another one that is phenomenal for you today. But let's talk about who's supporting the podcast. First, sponsor, Open Gate Farmstead. They are a stone's throw away from the mighty Ausable River, and happy animals make the healthiest and tastiest product. That's their catch line. That's their phrase. You've heard about them from the beginning. Check them out on their YouTube page. They do a lot of good stuff. That is Matt and Sarah Craig, everybody. They live down in Keysville. They do quite a bit of stuff at the farm. They got vegetables, they got pigs, they got ducks, they got chickens. I believe they are getting lamb. I could be just throwing stuff out there, but it's true. They are definitely growing a very small farm-to-table operation, and it's really exciting to have their support of the podcast. So thank you again, Open Gate Farmstead. Check them out on YouTube, Facebook, Instagram. They got a phenomenal YouTube channel. Check it out, subscribe. Sponsor number 2, we have Kavanaugh Realty. They are a local independent real estate company helping people buy and sell their homes. Pretty straightforward mission operation. They got a great group of people over there, and it's growing. Actually, they are definitely growing, doing a lot of business in the Adirondack, Clinton, Franklin, Essex area of northern New York these days. Definitely a lot of great things coming from that real estate company. I've said it before in the past, we're blessed to have so many great local real estate professionals, brokers, salespeople in this region. But Kavanaugh Realty really appreciate their support of this podcast because their support of my wife and I when we were buying our first house was incredible. Galen Trombley went above and beyond, and we really can't thank him enough. Changed our lives getting into our first home. So thank you, Kavanaugh Realty, #Local Matters. Check them out. Our third sponsor, near and dear to my heart, Adirondack Mindfulness. If you have listened to the previous episode with Dr. Sharon Thoreau, you learned a lot about mindfulness. You learned a lot about what she does for a living, how she found herself in a career of neuropsychology and mindfulness. She's bringing her expertise right here to Plattsburgh. She's originally from the area, so she is local in that way. She currently lives in Florida where her practice is, but she's bringing it up here with a company, Adirondack Mindfulness. And she's bringing an MBSR course up here, mindfulness-based stress reduction. It does come with a little bit of price tag. You got to pay for it, but it's worth it. It's an investment in your mind, and I will be doing it. It's going to take place for a couple hours on a Saturday from mid-November through the first Saturday in January. I'm not sure on attendance requirements. I think you should try and attend all of them if you sign up, but I'm going to be doing it. My wife, Lauren, is going to be doing it, and we're really excited to take that plunge into an investment in our mind, especially as the weather starts getting colder. It's a great thing to do on a Saturday. So, Adirondack Mindfulness, they're enriching the lives of North Country residents through education, research, and the application of the science of moment-to-moment awareness. Check them out, adirondackmindfulness.com. In today's episode, we have Paula Gonyea. She's an excellent guest. You'll learn a lot from her. I certainly did. We talk about healthcare. We talk about how hospitals are funded, which was really interesting to me. She's a very accomplished professional in our local healthcare system, UVM Health Network. And we also talk about her unique story of Gumption, which actually involves a story with my wife when she was a baby and she was sick. Very interesting moment of reflection, and We had a little conversation at the end about Paula's side hobby, which I think is really cool, Adirondack Taste and Green Mountain Gifts. Really neat stuff that she does with that. So enjoy this episode of the Stories of Gumption podcast. Gumption, defined as initiative, aggressiveness, resourcefulness, courage, spunk, guts, common sense, and shrewdness. Welcome to the podcast. This is Stories of Gumption with your host, Ryan Lee. All right. So today I'm with a very special guest, Paula Gonyea. She's the network director for radiology at the UVM Health Network in Vermont. She's also the founder of Adirondack Taste and Green Mountain Gifts. Maybe we'll talk a little bit about that. I think it's a pretty cool hobby and growing project. She's also my mother-in-law, which is probably the most important, but because she deals with a lot of my nonsense. But welcome to the podcast, Paula Gonyea.
Thanks, Ryan. Thanks for having me.
Absolutely. So I'd like to start by having you kick things off by just kind of giving us your background story a little bit.
Okay. Let's see. I am the youngest of five, born in a military family. I was born in Florida, and we moved up to New York when I was little. Grew up in Keysville, New York.
Shout out to Keysville.
Keysville, New York.
I got some friends who live in Keysville, including the Open Gate Farmstead sponsors of the podcast. A little plug there.
There
Sorry.
you go. No. It's beautiful, picturesque little town. So I had a great childhood, had really cool parents and cool older sisters and an older brother. So let's see.
And your father was in the Air Force.
Yes.
So he was here stationed at Plattsburgh Air Force Base.
He was stationed at Plattsburgh Air Force. Yes.
That's cool.
Yeah. And he retired here. And so this is where I landed. And I grew up, obviously, my high school years, I grew up here. So this is always going to be home for me. Whereas my sisters mostly grew up in Florida, and, it was home to them down there,
Now they're in Florida.
And now they're in Florida.
Yeah.
So we're kind of, a little bit all over the place, but it's good. It's can't complain. Had a really fun childhood. I loved gymnastics. I had the best coach. Gib Brown was my coach, so shout out.
Gib Brown, yes.
Yeah, yep.
He's a meteorologist.
He's a meteorologist, or he was.
He was just recently retired, right?
Yeah. So yeah, I coached gymnastics for a couple years, after I graduated, and so yeah, I guess I've, pretty normal childhood.
And so now, fast forward, you at some point in time decided you wanted to go into healthcare.
Yes.
I'm interested in that.
Yeah. So we had a guidance counselor in high school who encouraged a lot of kids to go into x-ray school, because there was an x-ray program right here at CVPH, and they still have a program today, which it was a great experience for me. I was drawn to radiology because of the it's an art and a science. You're really taking images of people at a tough point in their life, and so it's got that piece of the healthcare nurturing, but you also have the technical side, which I thought was kind of cool with the physics and science, and so that's what drew me to radiology.
I'm probably putting you on the spot here because I have no clue. But how does an X-ray actually work? Like I have the general concept. The particles go sort of through your body. It picks up the more dense part, which is your bone.
Yeah.
You
got it. You're
okay.
on there.
Well, help me out, because I feel like I'm just kind of spitballing here. I don't really know.
So I'm pulling back from like 28 years, but I will try to do the best I can here.
Sure.
Okay. So X-rays are produced. Hopefully, there's no physicists listening to this podcast because they'll say I butchered it. But X-rays are produced with a beam of electrons, and they're they travel through this vacuum.
Mm-hmm.
And once they hit a heavy metal target, then they, bounce down through the body. And so the areas that are bone that are really dense, the X-rays don't penetrate that as well. And so they show up as white. And so what you see on an image for X-ray, the black is really all of those, electrons that make it through the body. And then where you see white, it's the areas that were too dense and they didn't make it through.
Wow.
So that's how you get an image.
So when I went as a kid multiple times, if my parents are listening, they know they took me to the ER multiple times in school because I kept breaking things. Every time I went for one of those X-rays, I had just massive amount of electrons just sitting on my bones after, or like I don't know, how does that part work? If they don't pass through, where do they go? Do you know?
Well, it's called scatter radiation. So if it doesn't go through, you do have some scatter radiation, but it dissipates, and
okay,
I'm thinking you're fine.
Yeah, it's not Chernobyl.
No,
yeah,
you're good.
Which that was a crazy show. Did you watch it?
I did. It was crazy.
Oh my gosh, that was just a scary event in time.
So I think you're good. The few X-rays that you had, I think you're safe.
Well, and the technology has stayed the same, or I'd assume it's improved.
Yeah, it's completely different from when I went to school, because now everything's digital, and we used to have film, and you'd actually go into the dark room and you'd process the film.
Oh wow.
Yeah. So
wow.
I remember there's a light in the dark room. It's like the red light that you see on TV, right? And so it's very dim in the dark room, and there's a little safety switch on this film bin, so that when you open up the film bin, if you opened it and the bright light was on, it would automatically shut off. So it was a safety feature, which was really kind of cool for X-ray students that had never touched film before. So it was a nice safety feature. And a bin of film was thousands and thousands of dollars.
Oh my
God.
God.
It was very expensive, and you'd have different sizes depending on the body part that you were doing. And I remember I was always very mindful of that, the light, because I was like, I don't want to be responsible for ruining thousands of dollars of film. And I went into the dark room, and for some reason, the switch, something happened with I don't know what happened, but the wiring was tripped. And when I opened the drawer, the light came on.
Uh-oh.
And I was like, I slammed it, and I ran out, and I told the manager, and I said, I swear that I did not expose this film. But when I opened the drawer, the light went on, and he's like, yeah, right. So he went in, and he did the same thing. So.
Oh, good.
Good. Luckily, it was reproducible.
Yeah.
Sometimes that doesn't happen.
Gosh, so thousands and thousands of dollars for this film, and now it all being digital. I assume that's just there's no expense there now.
There's no film. Yep, everything's just you can have it on your iPhone within minutes.
Wow.
Yeah.
That's cool. So I want to come back to that, and I want to come back to sort of your climb in healthcare to becoming the network director. Radiology, that's a pretty big job. But I'd like to ask you, because it is the Stories of Gumption podcast, what does gumption mean to Paula Gonyea?
So, from my perspective, this is just me. Gumption is that intrinsic grit that you have that allows you to do something important. And to me, it doesn't have to be something big, but it does need to be important.
So what's a story of gumption from your life where you had to demonstrate some of this grit?
I would say once I had kids, that's when it really kind of became apparent to me.
Interesting.
That I was responsible for another human being, for their well-being, and not just myself. And so the story that comes to mind, I guess, when I think about gumption is when, so my oldest, your lovely wife.
Yep.
She was a little baby, and, I was a young mother, I was a new mother, and, I didn't have a lot of experience with sick kids, and she got really sick, and she was kind of a logy for a day or two, and she had a fever, and so it was about 104 fever, and
oh my God!
So that's that's high, and but,
yeah.
But you read all the books, and you ask, and they say, well, if it's 24 hours at that high level, you get it checked out. So I called the pediatrician, and it had been 104 for a day, and it wasn't really going down with Tylenol, or we were given ibuprofen.
Yeah.
So the pediatrician said you should just go to the ED because we don't know what it is. So why don't you just go to the ED? So I went to the ED, and I took my thermometer with me because she just was getting hotter. She felt like she's getting hotter and hotter. So I had my thermometer with me. I got to the ED. I checked in. And
ED, emergency
department, yeah.
I could tell you work in healthcare.
Yeah, sorry.
And I'm like, ED. I'm pretty sure that's emergency. But yes, I got it.
It used to be called the ER, right? The ER, but
that's what I still call it, I guess. But ED is more
so because
now.
You think about it, it's not one room; it's a department, right?
True.
So, yeah.
Clever.
ED.
Anyways, okay.
Those little things.
Okay, so you had to take you and Lauren going to the ED.
Yep, but just the two of us. And I don't remember, I think so. Jay was definitely. So my husband was working. And so he was in Vermont. And so I headed to the ED by myself with Lauren, and they checked me in and said, there's quite a few people ahead of you. Just have a seat, and we'll get to you when you can. So, my parents always taught me to be respectful and wait your turn, and, don't push back. And those are all good, things to teach your kid. I'm glad they taught me that. But as I was sitting there, she kept getting warmer and warmer. And so I took her temperature again, and it was up to, close to 105. And so I brought her up to the nurse, and I said, she's just getting hotter while we're sitting here, and I need her to be seen. And she said, have a seat. There's quite a few people ahead of you. It's a busy day. I'm sorry, and we'll get to you. We'll get to you. So I had a seat, and as we sat there, another 20 minutes later, I take her temperature, and it's up to 105.5 at that point. And
it's just a baby.
Yep, she's just a little baby, and she's getting hotter and hotter, and just kind of a little bit. Slumping, just like not, she was okay, but she just didn't have any energy. And so I brought her up again to the nurse. I said, I need her to be seen. She's up to 105.5 at this point. And she said, we'll be with her shortly, probably another 15 minutes. And so then I just looked at her and I said, okay, so where are your cold cloths? I just started to walk out, be like by her desk. And I said, because I'm going to take care of her. She's too hot. And so she goes, well, we'll be with her shortly. And so I put Lauren in front of her face and I said, you need to feel her head.
Oh my God.
And I said, feel her head now. And she put her hand on her forehead and she just sprung into that action that nurses do.
Yep.
And totally she took her from my arms and said, we're going to get her into a cold tub. And her fever was 106.9 at that point. So
can't that totally just kill you depending on who you are? That sounds really bad to me.
For adults, for sure. You could go into a coma. You could, seizures. Yeah. They said it was surprising that she wasn't seizing. And, I look back at that time and, this nurse was doing the best she could. She had a room full of patients and I'm this new mom who is probably overreacting and it's but when I just kind of shoved her in her face and said, you need to put your hand on her forehead and you need to feel how hot she is. She sprung into action. And
wow. And I'm sure she, not any malintent or malicious intent on her end. She was just trained to follow a procedure.
Exactly.
Right?
Yep. To this day, I give her so much credit for, springing into action and putting her into, the cold, tub and she just completely took over after that. But I think for me, it's I wouldn't even think twice about doing that today. You know, it's I wouldn't, but when I was, I was a young new mother and I respected authority and someone told me to sit and wait, I would sit and wait.
Yeah.
But,
yeah.
So now would I think of that as gumption today? No.
Yeah.
That's just
but at the time.
But at the time when I was, I was young, I was, early 20s.
That's a scary time.
Early 20s.
You're trying to figure it out.
Yep.
Yeah. That's interesting. Wow. Who knows where we'd be today?
That's true. We might not. You and I would not be sitting here, I don't think.
It's very possible if you hadn't shown a little grit and a little gumption.
Yeah, could be.
Yeah. Lauren, in case you haven't thanked your mother yet, you should probably thank your mother for all the things she's done for you. I'm sure she's thanked you many times.
Absolutely has.
So kind of shifting from that into a further conversation about healthcare, because you're a leader in healthcare, especially locally. I imagine that experience has shaped your opinion in how you lead people in healthcare and radiology.
Yeah, that experience sticks with me, and I think about, for me, the patient and family experience is pretty important, and we're always trying to, think about the things that could make it a little bit easier for patients or, better for patients, and not just the patients, but their families as well, because they're going through this difficult time alongside with their loved one, and so we're really trying to, make it patient and family friendly.
Yeah, no, that makes a lot of sense. So I feel like the patient experience has become a big part of at least the local healthcare focus. I can just remember, I've being a young teenager to now and having very different experiences just going to CVPH and the UVM Health Network, sort of trying to consolidate resources to make a better patient experience. Do you want to just speak about that and sort of the benefits of us being part of a network?
Absolutely. We have a lot to gain with the health network, and given that many of us have our care at CVPH and at UVM, medical center, I've had a lot of my healthcare in Plattsburgh at CVPH over the years. I had all 3 of my children here in Plattsburgh and had really great experiences. And I've had great care in Burlington as well. And so as a health network, what's nice is that we're in the process of getting a medical record so that it's the same across, all the hospitals in the network. And also we're working on getting our imaging archive to be able to transmit images back and forth easily. We can do it today. We can send images back and forth, but our goal is to have this single, platform that everyone sees, without having to know, oh, Ryan had a head CAT scan in Plattsburgh. We need to know you had that in order to look it up in Burlington, whereas in the future state, we'll be able to see Ryan's record, to say, oh, yeah, we see that you had that CAT scan. We see the images. We have all of that.
Yeah. So. That seems like a pretty big advance. It seems simple, but I mean, before that existed, before the network existed, I mean, what was that like? Because I assume patients still would go to CVPH, they'd have an image done, but then for whatever reason, it was like, nope, you got to go across the lake. You got to get more advanced care.
Yes, so that when that would happen, they would, we'd send CDs back and forth, and
oh wow,
and that was like the early, times when we would send images back and forth. Well, back in the day, it would be actual X-ray film.
Yeah.
But
wow.
Yeah, so it's now to be able to just send images electronically in minutes, then it is a huge benefit because by the time you get over there to UVM, your images will be there waiting already, which is nice.
Wow. Yeah, that's pretty sweet. And I would assume, maybe you can't speak to this in detail, but there's a major cost savings across the hospitals involved for like consolidating resources.
Yeah, if we can, we're getting onto this single medical record, and that in itself will definitely be able to, it increases the, efficiency of care and the quality of care. And yeah, and there's obvious cost savings for having a network to be all on that same platform. So yeah, there's a lot of benefits to it.
It's interesting to me, like the whole conversation about the cost of healthcare, because there's 2 different sides to it, obviously. But me now being going on 2 years as a property and casualty insurance agent, I know nothing about medical insurance. Put that right out there. Know nothing about it.
It's probably good.
Yeah, but it is interesting to me that at least from a property and casualty side of the insurance world, insurance was kind of established for hopefully something you'd never have to use, right? Like you at its root, you insured a building, your home or whatever, because if it burnt down, you wanted to be able to put it back where it was at equal value.
Right.
But you're kind of banking on the fact that you're paying a little bit of a premium that you never have to use it. Like you don't want to have to use it.
Right.
Whereas health insurance, you're paying your premium knowing you're going to use it in advance. You're like, I am going to use this. I am going to be asking my insurance company to pay for my, whatever benefits they give me.
For some people. So if you think about it, that's kind of how insurance works, right? Is some people use a lot of it, the resources, and some use zero resources, right?
Yeah.
So it's like if you don't put a claim in for, when your car's dinged up or, whatever happens, and you want to keep your premiums low so you don't turn things in, you're just like, okay, I'll just, suck it up. With health insurance, you do have very low users of health insurance who actually, they're pretty low maintenance and very little, they probably, it's like they're paying a lot of insurance and
Yep.
for premiums. And they're probably not getting, they wouldn't even equal out, what they're paying in, obviously, in a year's time. Then you have people who use a ton of it.
Yeah.
Maybe they have different, disease processes. And
Oh, right.
so it
For
could,
sure. And they do need it.
Right.
They're in the right for needing it and using it.
Exactly. And then you have a catastrophic event. Maybe you have a car accident, and that could cost, hundreds of thousands of dollars, depending on, what happened there. So it is, in a way, it's a lot like property insurance, because you do have people who use their insurance and then other people who don't. And obviously, they, if everybody was high users, then we'd be in a worse place. But
Yeah.
But I guess the difference with healthcare is that you have preventative services that you do want people to take advantage of, and it is going to cost a little bit, to make sure that they get, their blood pressure checked, and that they have their physicals, and that they're, doing what they need for stress and wellness and all of those things. There's a bigger focus now than there used to be on preventative services.
Yeah.
Screenings. You have, mammography. You have lung cancer screening for patients that have been smoking for, 50 years.
Yep.
There's a screening program for that. So, yeah, it is different, but there are similarities too.
Yeah. Yeah. It's interesting. Yeah. 'Cause I've had conversations with a few others in healthcare, nurses to other leaders, and they talk about this shift of trying to get people away from going to the hospital for the routine or the not so serious medical need. Leave the hospitals in a position where they can leverage their higher tech, higher emergency, higher need, I suppose, services, overnight stay, things like that, where, surgery or whatever. So they can be more efficient there, but then most of healthcare pivots towards a preventative medicine with a primary health professional.
Right. The medical home, like people,
Right.
Call it their medical home. And
if you're more aggressive with your own PCP or primary care physician or right? I got it?
Yep.
Yeah, okay.
Yep, primary care.
I'm making
Yep.
sure. I see I'm
Yeah.
throwing out some lingo here.
You got it. PCP, ED.
Well, the reason I wasn't totally certain about that is because I've heard people referred to as a PCP that are not physicians, but I don't know if that's like your primary care provider. It's
right, a provider.
Yeah,
right.
okay.
So it could be like a PA.
Right, who's
right.
still just as qualified to do that. But anyhow, okay, so this shift to be more consistent in that type of care will lower the cost of healthcare long term, right?
Exactly. That's the goal. If you've heard the term population health is actually a focus on, it's a different model based on sort of like reimbursement for hospitals on taking care of a population of patients, rather than you come in and you get a CT or an MRI and we get paid for that service. With population health, it's more of you have this amount of money to take care of this population of patients, and you choose how to spend those dollars. And if the goal would be to do more preventative, so that you're not landing in the ED, that we can take care of you in an environment that's more appropriate. And so it's that's the goal. And it is expensive to treat patients at the hospital, where all of the high tech equipment is, and there's a lot of overhead costs in a hospital. And so the focus is really to say, how can we provide care at a lower cost that's high quality and
Yeah.
good access. And so that's the challenge.
It seems like it's hard to put a number on what it actually costs you to get certain levels of care. Like, I don't know if maybe that's part of the problem, but, and maybe you can enlighten me more on this, but, so I have I'll share two stories and then maybe we can just talk about it. But, the first is I have a friend who, fell, hurt his back, and he went to the hospital. I'm fairly certain he went to I should probably get my facts straight, but no, I'm pretty sure he went to the hospital. He has insurance. He got it taken care of. He got some medication. He got prescription. So there's a pharmaceutical element to this too, but he went home, didn't have to pay anything that day. About a couple weeks later, got a really nasty bill for the imaging and the pharmaceuticals and all that sort of stuff. So I don't know all the details, but it sounds like he walked in, got care for his back, had no idea what each piece of his care actually cost, and once he got his bill, he was questioning whether the fact that his insurance was involved and was paying some of it, but then he, for whatever reason, had this large out-of-pocket cost. Would that large out-of-pocket cost have been the same if we didn't live in a healthcare system that was constantly being funded, it seems, by insurance companies paying the bills, where it can kind of get inflated? Does that make sense? Am I
Yeah, I mean, that's a good question. It's insurance coverage is very tricky because you and I could both have Blue Cross Blue Shield insurance.
Right.
And I might go to the hospital for the same thing you do and walk out with a $25 copay. And you might walk out with, $3,000, bill that's part of your deductible, or out of pocket. So there's so many different plans.
High deductible plans, which is full. Yeah.
High deductible plans are tough. And so that's when patients typically try to shop around, because they're going to pay that high deductible. It's tough if you have to go to the emergency department or you're not, you don't really have that, ability to shop around. But part of the issue is too that the hospitals don't actually get paid what they charge. And that
Interesting.
That never...
I bet a lot of people don't know that.
Yeah, that never happens. And if you ever look at your explanation of benefits on your next visit, and you get it, you'll get it from your insurance company, and they'll have an amount of what was billed, and then they have an amount of what they paid, and then it'll show your portion of that, so their allowable amount is the amount they've contracted with the hospital. So let's say, you go for an x-ray and it's $300 and maybe they only allow $200. So right off the bat, that $100.
You're on the hook.
That's actually, nope, you're not on the hook because that was negotiated from your insurance company. So that $100, you'll never have to pay it, and your insurance doesn't have to pay it.
Got it.
But then you have, let's say they pay $200, or maybe they pay, $150 of that. There's a piece that says this is what you're responsible for. And that's based on their negotiations with the hospitals for certain fees.
So this is very interesting because I never knew that insurance companies were negotiating with hospitals on basically how much of the care they have to pay for. Is that right?
Yeah, it's basically, yeah. That's kind of
so
how it
if
works.
I'm a real slick sales guy for XYZ healthcare insurance company, and I can get a better deal for what my company has to pay on benefits than another one, I could get a competitive advantage in terms of just how much we have to pay for benefits. Essentially.
Yeah, I mean, I think
I'm oversimplifying this. I know I am,
yeah.
but like the concept is, I assume each of these insurance companies have somebody responsible for trying to maintain or negotiate these deals with hospitals.
Mm-hmm.
And
well, it's like negotiating the rate that the rate that they are willing to pay, and
interesting.
But it's all through a process that
It's a lot of math.
It is. It definitely is.
It's a lot of math. I think that's why, if you go back to my friend's story, not really knowing his plan or the details of like whether he had a high deductible or supposed to expecting full coverage or whatever, he seemed like he just didn't know how much. If he had to pay the entire thing out of pocket, never had insurance, he's like, I couldn't tell you what any of it costs. I don't know what it costs to get an X-ray. I don't know what it costs to, go see a primary care physician to have him check out my back. And this particular gentleman is a little more conservative and believes in more opportunity of free market, so to speak. So I think he's coming from the perspective of, like, if I could just make sure that, if we were just paying for these things, there'd be more competition between each hospital to have a better price. Mm-hmm. You see where I'm coming from there?
Yeah. Yeah.
It's an interesting question, I guess.
It is. It's really trying to apply.
Throwing a lot on you.
You're applying the free market in capitalism to healthcare. And when you think about healthcare, resources in our area are not exactly abundant,
Yeah.
And so it is kind of it's relatively small market here. Go to Florida, you're gonna find a clinic or a imaging center on every other corner. So their costs in Florida, if you look at their healthcare costs, they are really high. You look at costs in Vermont, for example, is one of the lowest in the country.
Interesting.
So it's the competition thing can be a double-edged sword because you can drive up utilization.
Yeah,
so
interesting.
The more imaging centers or the more hospitals you have, the greater the chance that people are gonna. They're going to order. It's there. If you build it, they will come.
Yeah.
It's kind of the same kind of concept.
Yeah. Wow, that's wild. Yeah. I think we could probably spend like 4 hours talking about this because I just keep asking question after question.
And I'm not an expert on any of this, but it's only what I've kind of dealt with.
Yeah.
No.
And I don't know if anybody would be unless they literally did that every day, 40 hours a week.
Yeah.
Healthcare and insurance and all that. It does raise an interesting question. And maybe I'm putting you on the spot again unfairly because it's more pharmaceutical, but like you think about the hot button, press that Bernie Sanders got when he went up to Canada, purchased insulin for a fraction of the cost that it is to buy the same product here in the United States.
Yeah.
Like, do you have any idea why that is? Or I'm kind of putting you on the spot again, but
I don't know a lot about pharmaceuticals and pricing, but I do know that there's a ton of R&D that goes into it. And so, but again, it's like, I don't know enough about pharmaceuticals. I think that there are cases where the prices are jacked up way higher than they should or need to be. But at the same time, I always ask that other question, that other side, to say, well, how much did it cost to get that to market?
Yeah.
So. Yeah.
So, what kind of initiatives are you implementing here at the network, UVM Health Network, as director of radiology? Some hot button things that you're happy to share, like that you're working on.
Let's see. We have a few projects coming up in radiology that we're excited about, looking at new MRI system that we're going to be putting in. And
How much does an MRI cost?
I can't say.
Oh, okay.
Only because we get really good pricing, and we're not allowed to divulge that. But I can tell you that it's I can tell you that it's in the over $1 million.
Oh my God.
Yeah.
I was like, all right, this sucker's gonna be, several $100,000. I was saying, but yeah, $1 million. I guess it's a.
So we, and anyone could look it up actually online, because we had to file a certificate of need with the state of Vermont.
Yep.
Any expense in that range has to get reviewed by the Green Mountain Care Board, and they take a look, and they want to make sure that we're not driving up healthcare costs needlessly.
Mm-hmm.
And so they review all of these big purchases that kind of come up. But this MRI unit was actually put in 1998, so I think it's high time it gets replaced.
Okay, so that's about the average tenure or time frame of a lifespan of a MRI machine?
This is older than normal. Yeah.
Okay.
But it's been solid. It gave its best to us, so we can't complain. But
what happens to an old MRI? It just gets donated to another country, or it?
Well, that's a great question. And so
massive machine with all this technology that's no good for us anymore, but
right.
Maybe it's good for somebody else.
So we tried that. The last MRI that we replaced was a few MRIs ago, and I had grand plans to donate it to Macedonia. And
no way.
Yeah, it was. I put a lot of effort into researching it, and we had the Vermont Air National Guard that was going to actually take the unit to Macedonia. So we had everything in place that we could send it to them.
Oh, wow.
And we've done that before with a CT scanner, and we were successful. The problem with an MR scanner is that they are really expensive to run, because you need what's called cryogens to keep the MRI cool.
Interesting.
If it gets too hot, then it's not going to work. But there's a lot of shielding that you have to put in a room to make sure that the signals don't get crossed. And I'm not even going to try to get into MRI. You can have Jay come on this podcast, and he can explain that to you someday.
Our family expert on MRI.
Yes, he is all things MRI. I know just enough to be dangerous, but not. Yeah. But anyway, I tried to. I worked with this group in Macedonia to donate it. They were very excited about it. But at the end of the day, they couldn't raise the funds that they needed to construct the room.
Wow.
And
so it almost would have been a burden because of the cost to run it.
The cost to run it and to service it. So you do have to be mindful when you're trying to donate to other countries that, if they're, not in a place that they can afford the upkeep, then you're actually doing them a disservice.
Wow.
So.
That's crazy.
Yeah.
Look at that. I've learned a lot in about 40 minutes here. I would like to ask you, I'm pivoting just a smidge here, about your Adirondack taste and Green Mountain gifts.
Oh, okay.
Just a little bit, because I think it's cool.
Yeah.
But where did that whole idea come from? Tell people what this is about. This is a cool thing.
All right. So... this is my desire, I think, to get in touch with my artsier side. So my mom is an amazing artist. You've seen,
for sure.
You've seen her work.
She's a natural talent.
She really is, and she does beautiful icon work, very detailed. And so I don't necessarily have that talent of painting, but I do have a craving for, I guess, some kind of art or some kind of something. I don't know what that is. it's something to escape from my work.
Well, that's my this podcast for sure. But really the chairs, the Rondack chairs and furniture.
Exactly.
You work with your hands a little bit, a little more creative.
Right.
I can totally empathize and relate to that.
Yeah.
Desire.
So I had this desire to do something just to keep my mind off of, the stresses of work and stuff.
Mm-hmm.
So kind of, my mom taught me how to sew when I was young. So, I can sew, like pillows or, clothing, whatever. I like pillows because they're easier. In cooking, baking, I love like the gourmet, cooking.
Yeah.
I'm not an expert by any means, but I've taken a few classes from chefs that I just enjoy it. I do it because I like it.
You made apple caramels that were just like apple cider caramels that were just like Lauren. If Lauren's listening to this, she's like, "Yup, those were amazing." I never seen her. I mean, I've seen her gobble up sweets pretty fast, but I think she really liked those. I definitely did. Those are unreal.
Oh, thanks.
You got to figure out how to mass produce those quick.
They're actually, they're easy to make and they are good. Like the cider. Oh, I love the cider. This time of year is perfect for that. But
oh yeah.
But I could spend all day in the kitchen and just like, I don't get tired of it. So I guess if I worked in a kitchen, like if I had to, maybe I'd feel differently. But when I have a day off, I can hang out in the kitchen all day and be very happy.
So what we got to do, I'm putting this out there in cyberspace. I don't know if will actually do it. So no promises, anybody, but maybe a Adirondack Taste and Green Mountain gift down pillow with a Rondack chair. That could be a tandem.
That's a great combination.
You put you got that thing that, what's it called?
A cricket?
A cricket. Cricket, yes. Yeah. It puts like custom designs on the pillow. You made one the other day with a Rondack logo on it. I thought that was pretty slick.
Yeah, it's a cool tool, and I just have fun with it. And I was talking to a woman that I met at a bridal shower last week, and it was so funny because she said, "Oh my gosh, you have a cricket? I want a cricket." And I didn't even know what a cricket was, 6 months ago or 3 months ago. Didn't even know what it was. But once I discovered it, you could spend a lot of time on that too.
Oh man, that's such a cool thing. Like custom glasses, pillows, shirts.
Yeah.
I mean, anything really.
Yeah. Yep. Anywhere you can think about putting a stencil, and you can make a stencil out of any picture.
Wow.
So you could even take a picture, of Whiteface Mountain and just go ahead and cut out the little trails and stuff. It's cool.
Put it on wood. You could put the stencils on wood. You could put it on anything. Wow.
Yeah. So that's my escape from, the everyday work stuff. And I guess it's probably something that I got from my mom. I'm guessing, that, creative desire, whatever. Yeah. And I think that I think all of my kids have it to some extent. Yep. I think that they have a very creative side to them. So Lindsay loves to paint. She's very good at it. Yep. Adam is a very good cook, actually. He's really good. He's talented.
He is. He really knows how to hone in, his cooking. Yep. For sure.
Yep. And Lauren has definitely an appreciation for all things that I make. And she's
in particular, being the test driver for.
Yeah, she loves to test it.
Yes.
And her face lights up when she has that sugar.
No, she loves to bake too.
Yeah, she does.
She's been on a macaroon thing.
The macaroons she makes are amazing.
She makes some freaking good macaroons.
I've never made macaroons. Well, actually, I helped her make them once, but she is a master at macaroons.
I love to cook. I've always told her I hate baking because baking leaves very little room for mistakes.
Yeah.
Whereas cooking, you can kind of just like fake it till you make it and
Right.
add whatever you want until it tastes good to you and you're good.
Yep.
Baking is a science.
And macaroons
And
are even, I'm like, you're making macaroons? Are you crazy?
over and over and over again.
Yeah.
The first time, at least of this recent stint of making them, we made them together. I was so mentally exhausted after making macarons. She's since made all the rest of them solo, which I think is probably for the best of all the people consuming them. But it's a project.
It's a project, and it has to be exact, or they're not going to work out. So.
Anybody listening, if you're laughing there in the background, you're like, oh, well, macaroons, how hard can it be? I challenge you to go make macaroons.
You pretty much have to be a chemist to make macaroons, I feel.
Yes. Make them right.
Yes,
to make them perfect.
To make them right.
Yeah. Well, this has been good. This has been awesome. I learned a lot today, and we'll have to continue the healthcare conversation too at some point, maybe round 2 or the podcast or just offline or whatever. But
yeah, no, it's been great.
Absolutely.
Just testing my knowledge or my memory.
Yeah, I didn't throw you very many softballs.
How are X-rays produced? Oh God.
Taking you back to school.
Yeah.
Well, now it's time for the ever famous Stories of Gumption rapid fire section. Are you ready?
Yes.
Okay. The questions haven't really rotated out too much, so they're pretty similar. But question number 1: what's a book you would gift to a friend and why?
I would say it would be How to Win Friends and Influence People by Dale Carnegie. The reason why I would gift that book is what was interesting from that book. It wasn't so much how to win friends. It was the influencing people that I thought was really interesting. And it was really very much common sense, but some things that you're like, oh, yeah, you know what? I think there are a lot of things in his book that you could point to, like the, what do I want to say? It's like now we have a lot of neuroscience, behind, behavior and,
For sure.
And how do we actually, how are we drawn to people, and how are we drawn to maybe their perspective or at least understanding their perspective? And so there is a lot of neuroscience behind that and how you might be more accepting of a different perspective. And actually his book, I don't know when it was written actually, but it's an older book. And I think it superseded all of that. And it was
stands true today.
Yeah, I think so.
Wow. That's a good answer. I like that. I have this, I say this every time, but I have this long running list of books now that I have to try and catch up. Question number 2. If you could put up a billboard anywhere, what would you put on the billboard and why?
I would put RESPECT because I think that it applies to every single person that, just to keep in mind respect. Doesn't matter who you're talking with, who you're with. Doesn't, just respect is important to me.
And lost, it seems, a lot. It's less common to just find basic respect. I don't know.
Respect and empathy, I guess. I guess I'd put maybe 2 words, respect and empathy, because I feel like empathy is something that maybe we're lacking as well.
You know, if I can put the money together for 2 billboards, we can do both of those.
All right, thank you. I'd appreciate that.
Question number 3. You only get 1 more meal. That's it. That's all she wrote. It's kind of morbid, but hey, you get 1 meal. That's it. What would it be?
That's easy. It would be lobster and steak poutine.
Ah, that is damn good.
It is like I can't imagine I love it. It's amazing. That's like comfort food.
So that place that you originally got it up in Montreal is no longer serving it.
No longer serving it. They changed the menu, and that was a meal that Jay had ordered that I was like, lobster poutine, I don't know how good that could be. It just, I sat there and watched him eat
It's
that
poutine.
meal.
It's French
It's
fries. How
poutine,
good could
right.
that be?
I regretted every minute of that meal sitting there because it looked so amazing. And of course he shared with me, but I was like, oh yeah, this. So he made the best choice that night.
Yeah, that is by far, since making our own version of that, I would agree.
Yeah.
Question number 4. If you could go back to your 18-year-old self, what advice would you give to yourself when you were 18?
I would say be fearless. I think if I could go back to any 18-year-old, right? It doesn't matter if it was like myself or anyone today. It's like you can do more than you think. And when you're 18, you don't know, right? You don't know what you don't know, and you don't know what you're capable of. But I would say be fearless.
Yep. I like that. You have to be.
Yeah.
Because there's a lot of things to be scared about, it seems, when you're 18 trying to figure out the world. Right?
Yeah, exactly.
That's awesome. Number 5. We got 2 left. What is one of the best investments, whether financially, time, energy? What is one of the best investments that you have ever made, and why?
Oh, that's okay. I would say I have invested in 3 amazing young adults, and that would be my proudest achievement in my entire lifetime. And if I did nothing else but raise those 3 kids, and the way they turned out to be, I'm super proud of them. I would be completely fulfilled.
Wow.
Yeah.
That's fantastic. I don't even know what to say. There's nothing to say. That's fantastic. I'm just going to edit out all this stuff that I'm saying right now because we're going to leave it at that. Question number 6. This is my favorite question. This is the board of directors question. So, if we could put together a 3-person board of directors to guide and mentor you through the rest of your life, they can be alive, deceased, famous, or not, doesn't matter, but who would you handpick to be your 3 personal board of directors?
Okay, so if I have a board of directors.
And why?
Okay. Why too? I have a board of directors. So I'm the CEO of my life.
Basically, yep.
Yes. So I'm the CEO, and I am going to be privately owned, so I'm not going to do a board of directors. I'm going to have a president. So I'm going to change it up. I'm going to change it up. And the president who would be there to, mentor me or to, be the, I'm sorry, what did you say they were going to be doing exactly?
The just guiding and mentoring you.
Mentoring my Jiminy Cricket on my shoulder.
I feel like I know where you're going with this, though.
It's going to be a president. I'm not going to do the board of directors thing, and it's going to be Jay, my husband. And why? He's got really great judgment, and I trust his judgment. And I tend to be a bit of an idealist, and he's a little bit more of a realist. And so there are times in our lives when, he was there to kind of, shed some light that maybe I might not have seen. And I totally trust his judgment. And he's a really super cool guy.
Jay Gonyea for president. I love it.
I would vote for him.
Yeah. I probably would too.
Yeah.
He'd definitely get us moving towards some renewable energy. That's for sure.
For sure.
Man loves his renewable energy, and I respect the hell out of that.
He could. Yep. That's your next podcast. Solar, electric, and MRI.
Yeah. He knows a lot about all of that.
He does.
Well, thank you so much, Paula. This has been awesome.
Well, thank you. Thank you for having me.
And to the listeners, don't forget, you have an opportunity, if you haven't done so yet, subscribe on whatever you're listening to this podcast on: Apple Podcasts, CastBox, Google Play, Spotify, Himalaya. There's a whole bunch of apps out there. We're on a bunch of them. Subscribe so you can get an update every single time we put out a new episode. If you're interested in sponsoring the podcast, there's plenty of opportunity to do that as well. Send an email to storiesofgumptionpodcast@gmail.com. This has been another episode of the Stories of Gumption. Thanks for tuning in. Have a good one.